Mrs. Smith. I'm Monica. I'm your nurse, and I'll be giving you your discharge papers today, okay? I'm going to go over information with you about your condition, what signs and symptoms to be aware of, your medications that you're prescribed, when to go to the emergency room, and when to contact your doctor, okay? So when you arrived in the emergency department, you were severely short of breath and having trouble breathing, and you were lightheaded. Because of this, we placed a machine on you called a BiPAP, and it helped push air into the lungs, and this helped you breathe a little bit easier. When your vitals were taken, your heart was beating at a rate of 120, and your blood pressure was in the 150s, both are which are higher than normal. For a normal person, the heart should beat around 60 to 100 beats per minute, and a healthy blood pressure is around 120. So because you have a history of high blood pressure, and you're on medication for it, it's not adequately managed. So we have to change that medication for you. Because your vitals were elevated, this prompted for some lab work to be done, specifically labs that are related to your heart. So your doctor concluded that you do have heart failure. This was an escalating event. Since your blood pressure was uncontrolled, this damaged your blood vessels, making them less elastic and stretchy, which decreased your blood flow and oxygen being sent to your heart. This caused your heart to pump and work harder to push your blood through those narrowed blood vessels and to send oxygen to the rest of your body. Your heart eventually got tired of trying to compensate, which caused you to have a heart attack. And because you had a heart attack, this weakened your heart, and you couldn't push out the blood. So the blood was backed up in your veins that were running through your lungs. So there's a pressure buildup in your lungs. It's forced the fluid to be pushed into your lungs. So you were having trouble breathing because there was a fluid buildup inside. And so when you breathe, you need to have just air in your lungs, and you had fluid instead. So that's why you were having those symptoms. So your doctor prescribed 5 medications for you to go home on, okay? So the first medication that you're prescribed was aspirin. This is an antiplatelet medication, or also could be called a blood thinner. This was prescribed to prevent another heart attack from occurring. It works by thinning your blood, which helps prevent blood clots from forming. It slows the blood's clotting action by reducing clumping of your platelets. And platelets are used to control your bleeding. So you're at risk for bleeding, so you need to be careful about falling, being aware that you could easily bleed. So your doctor prescribed 81 milligrams, and you need to take 1 pill once a day. This medication is also chewable. So some side effects that you should be aware of for this medication is upset stomach, nausea, abdominal pain. You could even have stools that are dark and tarry. And you could have an allergic reaction too, which you could have a rash. A severe allergic reaction, you would have throat swelling, swelling of your lips, labored breathing, you can't breathe, you're having difficulty breathing. And in those instances, you need to call 911 immediately. So aspirin is best taken with food, and this is because it makes it less likely to upset your stomach. Like I said, this medication increases bleeding, so it increases even more if you take chamomile, garlic, ginger, or ginkgo. So before you take any natural remedies, please contact your doctor prior, because they may have unwanted interactions, and we don't want that to occur, okay? Your second medication that your doctor prescribed you was hydrolyzine. This is your antihypertensive medication, or also known as your blood pressure medication. This is the medication that's replacing your old one to help you control your blood pressure. So this medication works by widening your blood vessels to allow blood to flow more easily through your veins and arteries. It works by relaxing your muscles that are in the blood vessels, okay? So you are prescribed 50 milligrams 3 times a day. So you could take this in the morning, in the afternoon, and before bed. So some side effects you need to watch for this medication are fast heart rate, a headache, nausea, vomiting, diarrhea, and loss of appetite. Also, when you're taking this medication, you need to make sure you are changing positions slowly. So if you're in laying to sitting and sitting to standing, you need to have at least 5 minutes in between so your blood pressure can not drop suddenly. If it drops suddenly, you're at risk for falling, and we don't want that to happen. So this medication, it needs to be taken at the same time every day, with your last dose being at bedtime, like I said previously, okay? If a dose is missed, you need to take it as soon as possible, but do not double doses, okay? And you also do not want to stop your medication abruptly, because you can have a sudden increase in blood pressure. Your third medication you're prescribed is furosemide. This is your diuretic or your water pill. This medication was prescribed to you to help remove extra fluid and salt that's in your body, and also to help lower your blood pressure. This works by allowing salt and water to be passed through your urine. Your doctor prescribed 40 milligrams twice daily, so you could take one in the morning or in the evening. Side effects you need to watch for this medication are dehydration, muscle cramps, dry mouth, thirst, and headache. And because this medication is a diuretic, you will constantly need to go to the bathroom. You feel like you need to go pee every so often, and that's normal, because you want you to be excreting fluid from your body. Also, with this medication, take your missed dose as soon as possible, but do not double doses. And again, this medication can also change. You need to change positions slowly, because you're again at risk at falling, because it will change your blood pressure levels. Your fourth medication you're prescribed is spironolactone. This is also a diuretic, so it's also a water pill. So again, it helps to remove extra fluids that are retaining in your body. This medication is a potassium-sparing diuretic. So this prevents your body from absorbing too much salt and keeps your potassium levels from getting too low. This is why your doctor has prescribed this medication, so it can balance out both of your medications, so your potassium level isn't too high or too low. So having too low of a potassium level can cause muscle cramps, constipation, confusion, and severe symptoms are such as having abnormal heart rhythms. Your heart might feel like it's palpating, and shallow breathing is also a severe symptom you may have. Your doctor prescribed you 50 milligrams once a day. So for this medication specifically, your side effects you may want to monitor for are muscle cramps, dizziness, numbness, headache, chest pain, and irregular heartbeats. You can take this medication with or without food, but it needs to be taken at the same time and the same way each day. And it's also important to continue this medication even if you don't feel well. And again, we don't want you to double up doses if you forget a dose. Just take one as soon as you remember. Unless it's close to your next dose time, then just take that next dose, but do not double it. You're also going to want to avoid salt substitutes and foods that contain high levels of potassium, unless your doctor prescribed otherwise. And I'll go over those foods that are high in salt. Your fifth medication that you're prescribed is metoprolol. This is a beta blocker or another heart medication for you to take. This medication was prescribed to treat your blood pressure, prevent another heart attack, and also help manage your heart failure. It also helps with chest pain too. Since you just recently had a heart attack, this medication can help improve your survival rate. So this medication works by relaxing your blood vessels and slowing your heart rate to improve blood flow and decrease blood pressure. So your doctor prescribed 50 milligrams once a day. Side effects to monitor are fatigue, weakness, dizziness, diarrhea, blurred vision, and a stuffy nose. This medication should be taken with a meal or just after a meal and taken at the same time every day. Again, do not skip or double on your missed doses. Stopping this medication can abruptly cause life-threatening heart rates, heart rhythms, and high blood pressure, or even a heart attack. It's also important to check your blood pressure and your pulse before taking this medication. Any significant changes, you need to report this to your provider right away, okay? So all of these medications can be taken together at the same time whenever each dose is needed at their specific rate. So you don't have to worry about separating, taking one before the other. Just know that they are all compatible and you're safe to do so, okay? Okay, do you have any questions right now? I know it's a lot of information I'm giving to you. I just want you to be aware of what side effects you should know. Can you tell me some of your side effects that may occur with these medications? Great, great. Okay, perfect. Okay, so I'm going to continue with my teaching, okay? Okay, so I know you had some questions about your activity level. So I'll go over some information about that for you. So your doctor has referred you to a cardiac rehab program. In this program, you will learn how to slowly increase your exercise and how to take care of your heart disease. Getting regular exercise when you have heart disease is very important. Exercise will make your heart muscles stronger, which we need since your heart is weak. Aerobic activity uses your heart and lungs for a longer period of time, which you will use. It also helps your heart use oxygen better and improve your blood flow. So you want to make sure you work your heart a little harder every time, but not too hard. We don't want to overexert yourself. You can do activities such as walking, swimming, light jogging, or biking. These are all perfectly good exercise activities you can do. You need to do these 3 to 4 times a week, but start slowly, but pacing your activity. You need to make sure you take rest periods before you get too tired. Like I said, you don't want to get overexerted. If you have signs of dizziness, lightheadedness, you feel tired, you have chest pain, you feel you have palpitations, shortness of breath, or nausea, you need to stop, okay? It might help too if you wear comfortable clothing when you're exercising, so that will help as well. As for your work activity, I know you want to get back to work as soon as possible, but it's important not to push yourself to get back to work to your normal routine too quickly. If your job involves light duties such as administrative work and you're doing well, you'll probably be able to go back to work sooner. But if your job involves more physical duties such as heavy lifting or use of heavy equipment, it may take a little bit longer. And make sure you are avoiding heavy lifting because that'll cause too much stress on your heart, which could cause another heart attack. And we don't want you to have another heart attack, and we don't want you to come back to the emergency room again. Okay, they may They may be able to temporarily change your role or workload at your job until you are okay to go back to your previous role. Also in your home, make sure you have, your house is safe and easy for you to move around in, because we don't want you to fall, especially with these medications that change your levels in your blood pressure. We don't want you falling. So some other signs you need to be monitoring for are weight gain. So if you gain more than 2 pounds in a day or 5 pounds in a week, you need to be calling your doctor. And you can do this by weighing yourself daily at the same time, wearing the same clothes, to get an accurate weight. We want you to do the exact same thing at the exact same time, so it's as accurate as possible. If you are more short of breath when you're doing your normal activities, you have swelling in your feet or ankles, or you have symptoms that you think may be from your medications, you need to be calling your doctor. Okay. He might prescribe different medications or change your dosages, or even changing your diet. Okay. All right. So if you have severe, sudden, and unexplained shortness of breath, this is always taken seriously. You need to go to the emergency department. Unexplained severe chest pain is another symptom you need to be aware to go to the emergency room. In most cases, shortness of breath and chest pain will come together. So if you begin to experience severe body weaknesses, experiencing fainting, rapid, irregular heartbeat, palpitations, these need to be taken seriously, and you need to be seen in the emergency department as soon as possible. Okay, those are really good symptoms you need to be aware of, because they can be life-threatening. So do you have any other questions right now? I know these were a lot of symptoms we wanted you to be aware of. Do you need me to repeat anything for you? Okay, can you repeat some of those symptoms back to me again? Great. All right, you seem to be really understanding this teaching. Okay, so last part I'm going to teach you about is just health management, about fluids, drinking fluids, your diet, and what you can and should avoid. So, okay, so first we want to limit your fluid intake to 2 liters a day. This is because you are taking a diuretic and we're trying to get rid of fluid. We don't want to give you more fluid. This is going to make your heart pump harder, and we're trying to avoid that. So you do have a fluid restriction of 2 liters per day. A 2 liter is about the size of the 2 liter bottles, I guess you could say, from like Walmart, that are this big. So just a reference size to give you, so you're aware. You also need to be eating less salt. You're going to be on a diet restricted to 1,500 to 20,000 milligrams per day. Okay. You can read on food labels to see how many milligrams are inside your food that you're consuming, so you can calculate so you don't go over your daily limit. And we want to do this because for a couple reasons, actually. Salt can make you more thirsty, which then will want to make you want to drink more fluid, which you're restricted on as well. Extra salt also makes fluid stay in your body. Lots of foods that are not so healthy for you have a lot of salt, so you want to just be aware and reading the labels. and not add extra salt to your food that you're already consuming. So, for example, foods that are canned foods, frozen instant foods, smoked meats, and even condiments like ketchup and mayonnaise are very high in salt content. So, just so you're aware, and we can manage your salt intake. So, foods that are great, that are low in sodium for you, are fresh fruits and vegetables. Baked chicken is a great source of protein for you to take. Plain rice and pasta, eggs, milk, yogurt, and other dairy products are great choices for you. But again, just being aware of reading labels so you know how much sodium is in each food you're consuming is very important for you to adhere to doing, okay? Do you have any other questions before I leave? Okay. Well, thank you, Mrs. Smith, and I will check on you later, okay? Thank you.